Good evening, ladies and gentlemen. Tonight we will be having an exclusive interview with one of the leading therapists for reintegration of child soldiers with post-traumatic stress disorder. Please help me welcome Dr. Bruce Wayne. Thank you for joining us tonight, Dr. Bruce. I know you have a busy schedule.
Well, thanks for having me. It's always a pleasure to inform people of the struggles many child soldiers have to face during and after the war.
Now, to my understanding, thousands of children who witnessed war will develop some sort of psychological disorder, which most commonly comes in the form of PTSD.
This is sadly very true. Many individuals that have experienced a war-like event, especially as children, will show symptoms of PTSD.
Now, for those of you watching who are not familiar with post-traumatic stress disorder, Dr. Bruce has agreed to give a brief teaching of it. Over to you, Dr. Bruce.
Post-traumatic stress disorder is a common anxiety disorder that develops after a traumatic experience that caused either mental or physical harm to the involved individual.
Which means the disorder is not something you are born with, right?
Correct, which makes this disorder unlike any other mental disorder.
That makes sense. What are some of the symptoms you find in former child soldiers with the disorder that come to your clinic?
Many of the patients I see talk about having flashbacks, nightmares and night terrors, hallucinations, a loss of interest in the things they once loved, and having sudden, violent outbursts.
Wow.
They also show signs of difficulty concentrating, irritability, being very alert and easily startled, and possibly having suicidal thoughts.
Can having PTSD cause other kinds of problems for individuals suffering with the disorder?
Unfortunately, yes. Many individuals will complain about having relationship problems and physical problems, including stomach pain and a hard time breathing. Having PTSD can cause the individual to also have a higher risk of depression and substance abuse.
How do you treat your patients?
There are different types of therapies that we use. No two patients are the same. Their life experiences and states of mind are not the same. Because of this, we try to use the appropriate treatment for each individual patient.
What are some of the therapies?
There is group therapy, which consists of a group of patients talking about their traumatic experience and dealing with the disorder with a therapist present in the room. Cognitive behavioral therapy is when the individual suffering from PTSD will work with a therapist to identify what triggers their flashbacks and fears. The therapist will then try to help the individual replace their negative thoughts with positive ones.
Isn't there something called exposure therapy?
Yes, there is. Exposure therapy is a type of therapy that tries to lessen the fear of the individual's memories and tries to enable them to control their own thoughts and feelings.
How successful are these treatments?
It all depends on the patient and therapist, really. Though according to many trial studies, anywhere between 50 to 60% of individuals no longer meet the criteria for PTSD.
Very interesting. Are there any non-traditional approaches to treatment?
Yes, there are several alternative therapies, including yoga, exercise, dance, staying active, finding a hobby, and so on. Basically, the individual should try to do anything that keeps them busy and doesn't allow them the time to think about the traumatic events that they witnessed.
This seems like such an unfortunate disorder for anybody to live with. Is there any way to prevent it?
Unfortunately, there is no way to prevent this disorder, which is why we need to try to stop young children from having to deal with war and the repercussions afterward, in the first place.
Why do children have a higher risks of developing the disorder?
Well, basically, since the children's brains haven't fully developed and matured, they are more likely to retain and store in their memories what they experienced during the events they were in or witnessed.
Well, that makes sense, I suppose. Do you have any last words you want to say, Dr. Bruce, for the viewers at home?
I just want to make sure that everybody watching this understands the severity of what these child soldiers go through every day of their lives, not just during the war but from the consequences they are faced with afterwards. They are in a constant battle with themselves.
Very wise words, Dr. Bruce. I would like to thank you for coming here and educating us about child soldiers with post-traumatic stress disorder.
It was my pleasure.
Let's hear it for Dr. Wayne Bruce.